Good morning. Welcome back to our channel. We are going to discuss the case note of Kelly Fernandez. Hope you are doing well. Okay, let's start. As you all know that in writing subtitles, we are getting total 45 minutes to do that. And the first 5 minutes are for reading and the remaining 40 minutes for writing. Okay, so what I would like to say to my students is that what you have to do is that first 5 minutes for reading, 35 minutes for writing, and the remaining 5 minutes for checking, because checking is so important when you're writing something in a hurry body. You may slip grammar, your spellings, or the structure. So it's better to give 5 minutes for checking also. Okay. And also, you know that the key point is that you should have to know what to write and what not to write. Simply when we say that in OET terms, that you should have to know which are the relevant points and which are the irrelevant points. To identify the relevant and irrelevant points, definitely we should have to know that to whom we are writing the letter. For that, always we have to go to the bottom of this part where this is given the writing task. We have to read that part, the writing task properly. I think you can see this. This is the writing part. I will read it for you. Using the information given in the case notes, write a letter to Miss Margaret Sam, diabetic specialist nurse, Timberlake Health Education Center, Suite 548, 34 Collins Street, Melbourne, requesting her to home visit your patient at home to provide instructions on continued self-care after discharge. Okay, so by reading this one, you came to know one thing, that you are writing this to Miss Margaret Sam, and she is the diabetic specialist nurse, and she's working in Timberlake Health Education. And what we want from her is so simple: provide instructions on continued self-care after discharge. Okay, so we know that we are going to write to a dietitian, right? So it's after knowing this one, it will be easy for us to identify which are the relevant points and which are the irrelevant points. And the main thing, the next main thing that you have to know is the date, and it's already given there, the discharge plan, and the date is 15 February 2019. Okay, so here we are writing for Kelly Fernandez, and we are requesting a home visit, and we are writing to Margaret Sam. Any confusion? Hope no. Coming back to the case note, we can check the top part. You are a registered nurse at Brookville Hospital, Melbourne. Miss Fernandez is your patient at the Livingston Memorial Ward. The first data that is given, date of admission, it's 12th February 2019. It's in the case note you can write that one, and patient name is there and date of birth is there. It's 2nd April 1975. Address is not much needed, but if to identify the known case or unknown case, we have to cross check the address. So here we already done, it's an unknown case. Okay, so the next to kin is Fernandez George, her husband. Actually, we should have to include the name of the husband, because he is the person who is who is explaining all stuff at the beginning of this case note. That means when she was admitted for the first time. Okay, then conditions given already here: abdominal pain and vomiting after party last night, that we have to include. Today, she's unconscious after feeling unwell and drowsy at home. BIBA with husband to the hospital. BIBA means brought by ambulance. And husband was there. And all these explanations he gave these explanations because she was unconscious at the time of admission. Definitely you have to write that one. And the husband thinks fainted due to diabetes. It's fine if you write or not. It's not at all that much. It's a semi-relevant point. If you can use, you can. Otherwise, leave it. Diagnosed diabetics 2 2 years ago. That's the you have to mention in your past medical history. And this is the thing: diet and medication poorly managed, misses insulin doses, diet, pancakes, 3 to 4 cups of coffee, cheese, omelette, muffins, biscuits, fish and chips, fried chicken, sweetened juice, wine daily, 1 to 2 glasses, whiskey occasionally. All these things you have to include because you're writing to a dietitian, and dietitian should have to know what type of food she used to take or she used to have. And another thing that you have to inform your dietitian is that she has to have a irregular eating pattern, and definitely she is fasting also for time being. That means for sometimes she will eat continuously for a couple of days, sometimes she will fast for a long time, which is also injurious to health. This also you have to include. And the next part we can see: underwent cataract surgery 10 years ago, takes multivitamins daily. This is irrelevant. There is no need to write that about this one. Okay. She's not very active, that you have to include, because in discharge plan it's saying that we should have to make her to do some exercises. So you have to inform the dietitian that she is not at all interested in activities. And if we know about activities, means she goes for a slow walk 1 to 2 times a week, not all the time. And no history of allergies, there is no need to write because there is no history of allergies and no medications, and nil relevant medical history. Okay, then the objectives. These are the investigations that, I mean, they check the vital signs is already given there here, and this breathing rate, BP, all the stuffs are there that you can include, and definitely the BMI also you have to include. And this is how she appeared at the time of admission: color pale, I mean, dry skin, lips were pink. Okay, cough was in there, so there is no need to mention, but this is an important: mouth clean and dry, acetone breathe was there, and all these analysis are there. The blood sugar levels is there, you can include that one, and the other lab test also it was abnormal, and you also have to write about the diagnosis, that is diabetic ketoacidosis. Okay, and the nursing management, what medicines they gave: there's bicarbonate, insulin, active fluids, aggressive IV fluids, insulins, and potassium replacement administrated. These things you have to include. And the next is on the next day, that means 14th February. Again, they went with some investigations. Okay, that also you have to include. ECG, there is no signs of hyperkalemia. There is no need to write that one. Potassium values are approaching normal, that you can say. And patient tired, and she's crampy and achy. You can include that one. And these things also you have to have this patient's educated re-importance of taking insulin on time, timely balanced meals to avoid emergency situations in the future. That also you have to include. Patient is ready to discharge. Anyway, that we will inform in the introduction part. And the next thing you can see: the discharge plan, diabetes education on diabetes specialist nurse, pre-diabetes maintain metabolic control in future, bringing wrong food, less physical activities, hyperkalemia, hyperglycemia, monitor urine ketones, right? These are the discharge plans which we have to include. Fine. So now we got an idea about this case note. That means what part you have to include and what parts you don't have to. So the first thing in your letter that you have to go with the address, sorry, not address. The first thing is that your date, and you know that when you have to write the date in expanded form, that is 15th February 2019. 15th February 2019. In this way you have to write. And we are writing this one to Miss Margaret Sam, the diabetic specialist nurse, and her address is Timberlake Health Education Center, Suite 548, 34 Collins Street. It's Melbourne. Okay, all these things are given here. The next is the salutation. We are writing to Miss Margaret Sam, and there is no need to go with the entire name. We need only the second line. So you will write like this: Dear Sam, and reference Miss Kelly Fernandez, and date of birth already we know, 2nd April 1975. It's given here, 2nd April 1975. So date of birth. Then the first part is what? The introduction part. And the introduction part, what are the main things that you have to remember is the first thing about whom you are writing. That means you have to write the name of the patient and you have to write the condition. So here the diagnosis is what? Let's check the diagnosis. I can show you here the diagnosis: diabetic ketoacidosis. You have to write about that one. And what you are expecting from the reader. You are expecting from the reader is that have to have a home visit. For why they are giving a home visit? To provide instructions on continued self-care after discharge. Okay, so the first part, introduction part. I'm writing to request a home visit for Miss Kelly Fernandez, who has been diagnosed with diabetic ketoacidosis. Condition we wrote the name. She requires education regarding diabetes and self-care after discharge. Our requirement also we wrote. And one more thing is as an additional information, we wrote that she is being discharged today. So this is the introductory part. The second paragraph is the timeline. That means we have to write the recent history. Then we will write the admission date. Admission date is already given here. You can see date of admission in the beginning where it is there. It's 12th February 2019. Then you can include there. And at the time of admission, what was her condition? She was unconscious and her husband brought her in an ambulance and they checked the blood glucose level. You can write the readings there and the symptoms at that date, at the time of admission, how she was. She had abdominal pain, vomiting, drowsy, unconscious, right? And what medications they gave at that time, IV fluids, vital signs they checked, these things you can include in the paragraph number 2. Now, paragraph number 3 and 4, that is one of the past medical and social history. We can write that she was diagnosed with she has been diagnosed with diabetics 2 years back. And as the part of her history, you can write about her eating pattern. She poorly managed the diet and the medications. She poorly managed the diet and medications, she missed medications, and she likes to eat pancakes, biscuits, and all these stuff. And every day she used to drink 1 to 2 glasses of wine, and she's an occasional drinker, and she's not at all active. All these things you can write in 3 and 4 paragraphs. And the 5th paragraph, it's definitely a recommendation, and our request is to arrange a home visit. And during the home visit, the person should have to educate Miss Kelly regarding the self-care and diet management. Okay. And 6th paragraph, it's so simple. Your further queries upon this letter will be a matter of appreciation. Okay. The last, yours sincerely, registered nurse, Brookville Hospital. Thank you. Hope you understood this case note properly. If you have any confusions or doubts, please comment us. And if you like this video, please like it, share it, subscribe it. Thank you. Thanks a lot.